Thank you, Mr. Chairman, and thank you to Ranking Member Pallone, both of you, for your leadership on this important issue, and also to Ms. Eshoo and Ms. Brooks as longtime leaders of this effort. We don't know when emergencies will happen. We only know that they will. We don't know how they will happen. We only know that they will happen with increasing severity and frequency. Whether it's devastating hurricanes in Puerto Rico and across the South, out-of-control wildfires in California or Oregon, or infectious diseases spreading around the world, we are facing a future of increasingly deadly man-made and natural biological threats. In San Diego, we have experienced severe wildfires and a hepatitis A outbreak just on the heels of one of the deadliest flu seasons people can remember. The 2017-2018 flu season claimed the lives of 341 San Diegans. Just last year, the CDC declared that the Hep A outbreak was one of the deadliest on record. From November 2016 to January 2018, the city estimates that 20 people died from Hep A and 580 people have been infected. Today, we have an opportunity to vote on a bill that authorizes funding to detect, prepare, and respond to public health emergencies with responsible congressional oversight. For years, Congress has not appropriated adequate money for public health emergencies, including the Public Health Emergency Fund. That's why I'm grateful to the committee for having worked with me and my colleagues in the Senate to include the updated Section 205, a provision that will put more than $150 million a year between 2019 and 2023 to CDC to pay for the predictably unpredictable in a responsible and transparent way. Hope that my colleagues will commit to continue working together in a bipartisan way to ensure adequate funding for the Public Health Emergency Fund and other important emergency preparedness and response priorities. And with that, Mr. Chairman, I yield back.